My name is Jane Hampton. I'm a tissue viability nurse working in Aarhus in Denmark. My team have had the opportunity to use Axel Heal in a small project, which I'm going to tell you about now, where we've experienced that it has stimulated wound healing and reduced pain for patients. We in the team identified which patients we wished to use Axel Heal with. They were patients with non-healing wounds, not necessarily with pain. Some of them did have pain. We also needed to make sure that we could place the electro pads. So when we identified the patients, they were introduced to the concept of Axel Heal and very briefly how it worked. The community nurses were shown how they could replace the electro pads, and we took photographs of the wounds every 14 days during the period that the project ran for, and we also assessed the patient's pain. We used the VAS pain score, which measures pain from 0 to 10, based on what the patient says it is, and we also used the wound quality of life scale, which has a number of questions, of which the very first question also relates to the experience of pain. We involved 20 patients. They had 22 wounds. We had a couple of patients with 2 wounds, which were incorporated with the Axel Heal device. Mainly older patients, as we can see, the average age was just over 76. The wounds had been non-healing, and patients have had them on average for 7 months. Wound area, we had some very small wounds, but also a couple of larger wounds. We looked at the effect on healing 4 weeks before the use of Axel Heal with the normal treatment, and we could see that 7 of the wounds were static, and in fact 11 of these wounds we included were increasing in size, on average with 3% each week. As you can see here, most of the wounds were on the lower leg, venous, arterial or diabetic down on the foot, and a small number of other types of wounds, mainly on the leg, but of course pressure ulcers, they were on the buttocks. So we looked at the experience of pain. As you can see here, 11 patients, 55%, had moderate to severe pain. So they had pain over 4 on the VAS score. And interestingly, 6 patients who didn't have any wound pain. As we can see, with the 11 patients with the severe pain, there was a huge reduction in pain for them when we had used Axel Heal. 58% reduction, where the average had been a score of 6, and it had dropped down to a score of only 2, which is only a mild pain, within 7 days of having put Axel Heal on. And the other thing that we were interested in was what was the effect on wound healing. As you can see here, as I've said, the wounds were not healing, and you can see on the graph here that there was a slight increase in the 4 weeks before we used Axel Heal. Axel Heal was used for 12 days, so we measured the wound at day 14. As we can see, there was an average reduction of wound size by 14%. Down to week 6, the wounds were only half the size they were when we started. 50% of all the wounds had healed within 16 weeks. And again, these were non-healing wounds, so we were very impressed with that. But what's also impressive is some of the stories of some of these patients. So I've got 3 cases for you here. An elderly lady with Martorell's ulcer on the forefoot. Martorell's ulcer is an extremely painful ulcer. She was not able to use full compression until she'd been given morphine and opiates and morphine gel on the wound, which had been used. We put Axel Heal on. She didn't now need to have the morphine gel anymore. And what was a big issue for her was that she had been fully independent, walking out to her allotment garden. Now she couldn't because of the pain. After a week of having Axel Heal, she could now walk without 1.5 kilometres down to her allotment garden again. And the best thing was, of course, that from the time we started Axel Heal, 12 weeks later the wound had healed up. Another lady here who had extreme pain. She's had a wound for 7 months. She could not use any form of compression because of the pain she had. It's a neuropathic pain of unknown origin. But after having Axel Heal on, her VAS score dropped from 6 down to 2 after 3 days. Day 7, in fact, she said to me, "We don't need to talk about pain, I don't have any." And she chose herself to take a Linus Stromp, a class 1 hosiery, on her leg again. And of course, because of the effects of the reduction in pain, she could now use compression, and this wound healed up after just 4 weeks of starting Axel Heal. Another chap, slightly different position. He's got an abdominal wound after surgery. He's had the wound for 10 weeks. There's undermining of 6 centimetres down and 2 centimetres to the side. The surgeons were planning to reoperate to have it closed. He didn't really want to do that. We put Axel Heal on. 5 weeks later, it had healed up. Really good results for these patients. So just as a summary, Axel Heal, for the patients, they were very happy with it. It was easy for those that could, for example, the gentleman with the Axel Heal on his abdomen, to disconnect the electrode cables himself. He also changed the electrode pads himself during the week. The patients who had the Axel Heal on their legs, they said they could just forget about it because once it was placed on the leg, they didn't notice it was there. An important thing for many of them was that the device was silent, but also that, of course, it reduced their pain. For the community nurses, again, extremely easy device to use in the patient's own home, easy to connect the electrode cables. They didn't always need to replace them. The device didn't need any attention from them, and they could optimize the treatment. So all in all, we've been very happy with the effect. Thank you very much.